Good afternoon, ladies and gentlemen. Welcome to the inaugural lecture of Kuok Group Professorship in Global Public Health and Humanitarian Medicine by Professor Emily Chan Ying-yang. Please rise for the official entrance of the procession. Please be seated. Good afternoon. I am Tiffany Sham, a resident doctor from the Department of Medicine and Therapeutics at the Prince of Wales Hospital. It is my honor to be your MC tonight. To begin, please welcome Professor Dennis Lo, the Vice-Chancellor and President of the Chinese University of Hong Kong, to deliver a vote of thanks. Professor Lo, please.
Mr. CY Leung, Mr. Stephen Ho, Mr. Alfred Chin, Professor Emily Chan, Professor Philip Chiu, colleagues and friends, ladies and gentlemen. Good afternoon. It gives me great pleasure to gather with you today to celebrate the inauguration of Professor Emily Chan as a Kuok Group Professor in Global Public Health and Humanitarian Medicine. We're honored to have Mr. CY Leung to grace us with his presence. We're glad to have Mr. Stephen Ho, Senior Advisor of the Kerry Properties, Mr. Alfred Chin, Director of Kerry Holdings China, to join us, representing the Kerry Group Limited. I wish to especially express my gratitude to Mr. Bill Kuok, Chairman of the group, whose generosity and benevolence of order has made this event possible. I'd like to thank Mr. Kuok for his passionate support for CHK's development as a comprehensive research university in pursuit with excellence and social responsibility in everything that we do to benefit humanity. Mr. Kuok is the eldest son of the renowned Malaysian Chinese entrepreneur, Mr. Robert Kuok, founder of the Kuok Group. Over the last 7 decades, the group has grown as one of the most dynamic multinational conglomerates in Asia. Its operation in Hong Kong and the Chinese mainland are currently overseen by the Kerry Group Limited, the chairmanship of which is held by Mr. Bill Kuok. Now, building upon the values of perseverance, loyalty, honesty, and integrity championed by his father, Mr. Kuok has been committed to extending the group's corporate culture to the wider community through charitable acts of the Kerry Group Kuok Foundation, Hong Kong Limited. Now, since its establishment in 2007, the foundation has demonstrated unwavering commitment to charity and genuine care for humanity, spearheading public welfare projects and championing causes across poverty alleviation, education, environmental protection, healthcare, and sustainable development in provinces nationwide. Its initiative weaved the business success of the Kuok family with philanthropic impact, fostering long-term social progress and advancing harmony between human and nature. Now, we're deeply grateful that the goodwill of the Kuok family extends to CHK with the establishment of the Kuok Group Professor in Global Public Health and Humanitarian Medicine. So on behalf of the university, express our profound gratitude to Mr. Bill Kuok for his strong dedication to Hong Kong's higher education and to social responsibility. Now, this memorable event also marked a significant milestone in the career of Professor Emily Chan from the Jockey Club School of Public Health and Primary Care of CHK's Faculty of Medicine. Now, Professor Chan will be officiated as the Kuok Group's Professor of Global Public Health and Humanitarian Medicine today. Now, she has been recognized with numerous international awards for her contribution to global humanitarian health intervention research and frontline emergency operation. Now, in her lecture today, she will share her experiences and insights from field practices, evidence-based research, and capacity-building initiatives in disaster and humanitarian medicine. I believe that this prestigious professorship will encourage her to continue to drive academic excellence in research and field practices to build resilience, lower disaster risk, and improve health for everyone. Professor Chan, congratulations on this most deserved honor. And once again, our heartfelt gratitude go to Mr. Kuok and the Kerry Group Limited for their generosity, which will enable CHK to remain in the forefront of global medicine to advance human health and create a lasting impact on the world. So ladies and gentlemen, I wish you a most enjoyable evening. So thank you.
Thank you, Professor Low. May I now invite Professor Low, accompanied by Professor Philip Chiu, Dean of Medicine, and Professor Emily Chan, to present a certificate of appreciation to Mr. Stephen Ho, representative of the Kerry Group Limited, and Mr. Bo Kuok, chairman of the group. Mr. Stephen Ho, Professor Chiu, and Professor Chan, please. Thank you all. Please be seated. Now please welcome Professor Philip Chiu, Dean of Medicine, to introduce our distinguished speaker tonight, Professor Emily Chan. Professor Chiu, please.
Mr. C.Y. Lau, Professor the Honorable Arthur Lee, Vice-Chancellor Professor Dennis Low, Mr. Stephen Ho, Mr. Alfred Chin, distinguished guests, esteemed colleagues, ladies and gentlemen, good afternoon. It is my greatest honor to welcome you to the inaugural lecture of Professor Emily Chan Ying-yang, who is conferred as the Kuok Group Professor in Global Public Health and Humanitarian Medicine. On behalf of the Faculty of Medicine, the Chinese University of Hong Kong, I'd like to express our heartfelt gratitude to Mr. Bill Kuok, Chairman of the Kerry Group, and also the Kerry Group Limited for this generous support and initiative. This professorship is a meaningful recognition of Professor Chan's achievement and a powerful endorsement of our shared commitment in advancing global public health and humanitarian medicine through research, education, and excellence in frontline practice. Today, we celebrate not only a personal milestone in Professor Chan's academic career, but also the broader impact of her work on the vulnerable population and resource-deficient community, on students and young scholars, and on the development of humanitarian medicine and public health diplomacy across Asia, Africa, and beyond. To me, Emily is always the superwoman of humanitarian work and healthcare leadership in my heart. Our pathway actually crossed beyond academic, where our daughters were classmates in DGS before. So we are also caring parents together. Professor Chan's journey in global public health and humanitarian medicine began with academic training at esteemed institutions, including Johns Hopkins University, Harvard University, the University of Hong Kong, and also the Chinese University of Hong Kong. Since joining CUHK in 2006, she has taken multiple leadership roles that reflect her breadth of vision and deep commitment to disaster risk and global health equity. She currently serves as professor of the Jockey Club School of Public Health and Primary Care, Assistant Dean External Affairs of the Faculty of Medicine, CUHK, Director of the Collaborating Center for Oxford University and CUHK for Disaster and Medical Humanitarian Response, CCOUC, Director of the Center of Global Health, and concurrently as the Chief Executive Officer of the GX Foundation. In these capacities, she has built bridges between academia and frontline action, leading medical humanitarian projects in the Belt and Road Initiative countries that have delivered disaster risk management, cataract surgeries, dengue fever prevention, and primary health care services to thousands and thousands of underserved individuals and resource-deficient communities. Professor Chan's leadership work is globally recognized. She has published over 400 articles and 15 textbooks, directly informing national and global policies. What makes Emily's story especially compelling is how she has been seamlessly integrated academic rigor with humanitarian compassion. She has never been an armchair academic. Her accolades include the 10th Outstanding Young Person of the World Award 2005, the Hong Kong Humanitarian Award 2007, the UGC Teaching Award 2017, the National Teaching Achievement Award of China 2018, and the Medal of Honor by the Hong Kong SAR government in 2024. Today, we look forward to hearing from Professor Emily Chan on her exciting and enlightening journey, the challenges of working on the front line of disaster and humanitarian crisis, the evolution of global public health and humanitarian medicine, the people and the communities that have shaped her vision. It is a story of courage, leadership, and unwavering commitment to health for all. And I'm confident it will inspire every one of us. So now please join me in warmly welcoming Professor Emily Chan to deliver her inaugural lecture.
So let me start by saying welcome to CUHK and thank you the VC, Dean Chiu, Mr. Leung, my donor, the Kuok community, and also, of course, Mr. Stephen, and also Mr. Alfred, Anthony, and all the colleagues. I have to point out that many people who are very important in my career actually attended today's meeting. And also, we have an online audience. And I must highlight it includes my humanitarian mentor, Professor Jennifer Leaning, and at Harvard, and a few others from Oxford that are actually online to join me and to see how far I managed to venture in my career since the 90s. If I may, this is a picture I must put right out there. That is Mr. Kuok, and this is very important because we have an interesting discussion of why he is interested in supporting humanitarian work. My area of work is always there. In fact, it has always been there since the beginning of Western medicine or even earlier, because humanitarian spirit is nothing new. The problem is till 2026 in the world, there really are not a lot of locations, especially academic platforms, that has specific dedication to support humanitarian medicine development. I'm very grateful for the university who allowed this particular area to flourish. We all know that our VC is famous for his experiments and scientific inquiry and all the patent that he managed to secure for the benefits of humankind. And our dean is also in the forefront of robotic surgery, which is very important in clinical medicine. But for my area of work, I actually work in areas that there is no system, no action guidelines. It's always evolving. But this is my world, and I love my work. I have been in this area for the past 30 plus years, but I still love it. So thank you, Mr. Kuok, for the support, and thank you for selecting this area as an area that you believe is worthwhile to promote and continue to develop in the university. For any good lectures, we must start with defining the area. I have very interesting discussion with many people about this topic, but perhaps this topic is divided by three major areas. In terms of what is frontline medical humanitarian response, what exactly is public health diplomacy, and what and why is it important, or why does it different in the digital era? So for all good reasons, these are the rim of discussion in the next 15 minutes, but I will share stories to make sure it's entertaining and give you food for thought. But I must start with encouraging everyone in this room, take out your phone and make sure that whatever I talk about, try to check the fact. This is the reality of all teachers in the 21st century. And that is actually exciting too, Many of the times in my lecture, my student taught me so much and make sure that I'm updated and I learn. So it's actually, people ask, you've been teaching for more than 20 years, are you bored? Never, because I always pick up new topics. And with that, I must start with telling you, I just came back from a trip as recently as yesterday with Mr. Leung and a few of my team members that was peppered across the audience. From where? From Tonga, Dean Chiu. It's not even Africa or Southeast Asia. Where is Tonga? It's very far away, but essentially in the global community, you can get there within 24 hours. To put it into context, I mean, my area of work with Tonga is because of my current common arrangement between CUHK and GX Foundation. I will talk about GX Foundation a bit later. I want to use my recent work travel, to illustrate why is the topic relevant and why is it exciting. People in this room, most of you are from the health or public health community. Take out your phone. What do you know about Tonga? Okay, a few of you laugh about it because, I mean, for many good reasons. First, Tonga is known for many interesting things. And in the audience, I do believe I have 2 or 3 audience member online is from Tonga. It's a small community of about 100,000 people. It's a community that is known to be rampant with natural disaster. Okay, I have a few slides to illustrate it, but I actually want to show 2 things. First is that with Tongan community, you basically find every natural disaster possible, from climate related, which is all the typhoon, cyclones, floods, heat, cold, to all earthquakes, tsunami, and volcano eruption. You can find it. And with climate, of course, things becomes more aggressive and less resilience are found in the community. So it's a community that is very hot in terms of hotbed of natural disaster. Second of all, it's a community, if you go on the internet, it's where another interesting reality of the 21st century lies is the issue of NCD. Again, I challenge you to go with your phone to check out the median age of the country. It's 100,000 people. Its median age is 21 years old. It's young. It's a young population. Okay, and just to put in the context, in Hong Kong, our average median age is 47.6. So some of you in this room, most of you in this room are still below the median. But still, if I ask a typical student of public health, undergrad, graduates, I say, if you have a young population with a median age of 21, what kind of disease pattern will you expect? You probably say infectious disease, maternal child health issues. They too have such issues, but the top cause of death is related to NCDs. One of the reasons behind that is that, according to WHO, this is WHO statistics, show that it's the #1 country with most proportion of obesity. 71% or 70.54% of this population is affected by obesity. And you can imagine it's a community that would actually classically experience the double epidemic. Both you have a young population, but people are affected by NCDs. And for good reason, among the NCDs, the top cause of death is ischemic heart, which the hospital system may not have enough to support. And second of all, it's related to diabetes mellitus. Okay, we know that type 2 is multifactorial. As a result, it has to do with diet, food, and habits. Those are very complex issues that is related to your development, socio-economic situation. We have a first-hand experience after we visit with my delegation together with Mr. Leung and Dr. Ko, is that the portion size of their food is at least 4 times, and they are really very good food. But it's just that, I mean, the way the behavioral and aspect, it's not easy the problem I'm trying to highlight is that all the genuine effort is the environment, the food nutritional habits. So even I'm not talking about the typical problems that GX as a foundation is addressing. We are already faced with a disaster-prone community, a community with NCD crisis with a young population. And of course, if you go on the internet quickly and just take out GX Foundation, easily you will find at least 30 or 50 news probably by Mr. Leung, talking about no dengue, no disease. Okay, he's the biggest fighter global for dengue fever. But that also is the reason why we go to Tonga. Tonga is the 13th country which I have been working with the team to build sustainable public health program. But why were we in Tonga? Because when we were, as a delegation, together with support from CU and Hong Kong U, since April, to actually build a side event in WHO Assembly this year. And the biggest argument we pose is that physical means is probably one missing or forgotten approach to deal with dengue fever. We all know that for dengue fever, there is a typical chemical approach by doing spraying, aerial spraying, land spraying, all the way to the latest technology about talking about biogenetic mosquitoes. They are good intervention, but to be honest, it's top down. It requires government, it requires policy, it requires money and resources. As an individual like you and me, if there are mosquitoes flying around, the only thing you can do is either you try to kill it with your hands or try to do something, maybe a mosquito lamp. That is exactly what we are arguing. There are simple measures as individual, as household. There are things that we can do. We have a passionate argument, did quite well with WHO to a point which at least the effort is to hopefully promote and advocate for adding physical means as an approach in dengue or vector-borne control. Then there comes our minister from Tonga, who requests to have a discussion with GX Foundation because Mr. Leung was there. So he, the minister, came and have a discussion. And as a result, Mr. Leung said, yes, let's go. That is what's happened. 2 weeks afterwards, we're in Tonga. That is the privilege of being able to work in the third sector alongside with the academic world, because we can find a solution, we can work in the front line, and even better, it's the best way to understand what's going on in the world. Because people think island population, that is very special. That is community after visit. We know there's no frogs, no snake, and there's not even malaria because Anopheles as a factor doesn't exist. But there is our dear dengue fever, the mosquito, which I will describe a bit later. So that gives the reason why we were there. And that also shows that if something seems to be useful, you will be encouraged to go further. Okay, so this is just to show you that for 2025 and 2026, the outbreaks of dengue fever. And so what we did, very typical, and this is not just start with GX, in fact, start with the time when I was in my early life with MSF, my later life with other NGOs, and of course with CUHK, that we go to the field. We know regardless whether it's digital or not as a time, there's no way to know what's happening in the field with only one way, is to be in the field, because you have to understand what is going on. So these are some pictures that we went to the market, we talked to people, and on the right-hand side, interesting, is the fish market. The fish market is next to the seaside, and it's quite an interesting experience. And there's a lot of flies, by the way. Vector-borne disease doesn't stop with mosquitoes. Flies is something that's common, something still. Ask your own self, if there's some flies around your household, what do you do? Okay, what are the physical means that you can deal with it? It's actually quite interesting. And in the digital era, do you do the same way? And of course, this topic is about health diplomacy. We go because of Mr. Leung and various diplomatic reasons with the Chinese delegation. We were there to meet with the Prime Minister, to an extent meeting with the Prince. Okay, so I'm an academic. I have a lot of opportunity to be exposed to quite interesting protocols and experience. And that, I would tell my young students, is the exciting part of being in the humanitarian sphere. Because once you're out there, they may have all the titles and affiliations, but at the end of the day, they talk to you, aside from the duty, it's also they may be interested, because they are still interested to protect their community. At least this is what we hope. So, we, aside from going all the way to the fish market in the seaside, basically a store, all the way to meeting with the prince. And what needs to be done? I will promise to explain to you what we've done in other countries, as a frontline agency later, to illustrate what are the latest frontline medical responses needed. But similar to other approach that we work, especially in our partner countries like Timor-Leste and Honduras, we decided to help all the health facilities, basically the main hospital in the country, and all the ports, airports, gateways, and all the way to cargo ports, which is the main entry point of the country, to install physical means in dengue control. Talking about that, it's an example of things that we replicate our efforts. We did it in the other countries I mentioned. And for that, I need to mention that in this room, thank you, Rector. We have the Catholic University of Timor-Leste. I bring the delegations to be here. So this is a global community, truly global community. Thank you. And just to put in another context, it's an interesting aspect aside from being in the field. It's the strategic location. Because, I mean, Polynesia is an interesting area that was very wide in terms of the spread from Hawaii in United States, New Zealand, all the way to Easter Island, okay? But essentially, this is a community that we don't know much. Not just we as from Hong Kong because we are far away, or from China. It's that globally, we have very limited literature, document what's happened. I think the latest documentation of Tonga is probably about a volcano eruption. And perhaps, I mean, of course, the obesity epidemic, but essentially what I want to try to highlight, I mean, the fulfillment as an academic for inquiry is that whatever we do in the field is something perhaps meaningful to develop education materials that can benefit further. We always talk about digital era, talk about AI, but the AI will have to draw information from somewhere. Where does it draw it from? Then we are producing the information. We have to. That's why frontline response or being in frontline is more important nowadays than even than before, because we just have to go and find out what's happened in order to generate solutions. So that is the backdrop. As you can see, there's a country with all sorts of risk, health risk, with all sorts of needs, probably are not being talked about if we are not out there in a high-level conference to have a chance to meet with the minister. We may not be invited. So there are many serendipitous relationships that makes this happen. And the reason why I need to bring all this up is just to show you the complexity, okay, of the type of work I do. I think field activities becomes my laboratory. In fact, humanitarian laboratory is always in the field and it's real. It's brutal, but it's real. I will tell a few stories of my early days because just to show that how young students who aspire to go into this area potentially may start their journey, their humanitarian footprints. But I tell you, it's nothing glamorous. To start off, this is when I did my work, I mean, when I was in university, like some of the participants may be, joining initiatives that talks about food insecurity, maternal and child health. And for good reason, I love to travel. I love to take pictures. That's why, but I didn't take my own picture. It's my colleagues who take the picture. And in the old days, you won't be able, this is the only replicate photos I have. And now it's everyone has a phone, okay? But essentially, it's always worthwhile to take good pictures because it reminds you where you start your work and your journey. Then many years after the first journey as an intern, I professionally joined NGOs and I love my NGO communities. All I learned in the field is from my colleagues. Okay, and it's a very humbling experience because humanitarian medicine is one of those areas that we know we may not save life, but minimum we want to do is to preserve dignity. I think the common understanding is that there are limitations of science, but as human beings, at least we believe that there are certain dignity, respect that we should give to another life. And that is also the reason why many of my colleagues, they may not start out with humanitarian work. With time, they will join because they believe in the ideals and at least the principle of doing this. With CUHK, I think Dean Chiu has already described my background. I joined CUHK in 2006, and I'm very glad Professor Sean Griffith is here. She was the one who was brave enough to recruit me because I'm off the beaten track. And thank you very much. I know in the audience there's Professor Joso, okay, who was there to ensure that I should be tenured. So at least I can do all this off the beaten track work. I will not go into detail because outside there are different like posters and there are like description of my work in the on the internet. But I want to highlight to you that before I managed to build this as an area with my team, we do a lot of things with students, and that gives me workforce And now many workforce becomes professional too. So that is the satisfaction of being a teacher. On the left-hand side, on your side, I used to run model WHO assemblies or model UN, and people would dress and resume the duty for the next 10 lectures as their own country. All the 13 countries which GX is working, interestingly, are all represented at one point or the other. I was trying to make a brave attempt to find out all those teams and groups that represent the country I didn't manage. I don't have enough time. But somehow, one way or the other, my students, many of them are in the room right now. Now, some of them become professors too. They actually were in that group. And now they are going to the field to solve real-life problems. And yes, I find very interesting locations. I mean, locations where there's no medical teams normally venture to. On your right-hand side, that is when I travel with Professor Samuel Wong to Bhutan. Okay, and I've been teaching in the health service, University of Health System, health service for about 3 or 4 years, because that was where they are developing the health system. Those are things which I did with the university early days. And these are other pictures which I manage. I think the most successful approach for this is I manage really many support. I have, of course, Professor Sean Griffith right there. I have Professor Jeveline Vincent, Professor Vincent Mott in neurology, who joined me in the field, and many others. As a result, I mean, in 2011, we managed to build this very interesting platform called CCOUC. It's where many things happen in CUHK with the support of our academic community. Essentially, it started out as a little center for research. And with time, the focus is very emphasis on humanitarian medicine. How do you build it? How do you generate evidence? How do you train students for it? In view of time, I won't be able to go into details, but humanitarian medicine, at the end of the day, it's about protection. Protection from unnecessary preventable death and injury and harm. And you use whatever skills you can find. Medicine, public health, logistic. And the latest development is that when you build as a recovery, you try to do it better. Okay. And this is CUHK. Even this little center survived for 15 years. And that's why a lot of stories, early stories related to CCOUC. This is the milestone. And I would want to highlight one thing as an area for humanitarian medicine and global public health. We always try to conceptualize things, but there are two ways to think about it. It's top-down and bottom-up. Top-down is where policies are being drawn up and health service being organized. But bottom-up is the gap. Is what's happening in the community. Many of the times people will base on previous reports to triangulate results, but we are living in the different times. A lot of old reports may not be able to reflect the new needs. That's why for digital era, we need to relearn about the community. We need to understand the latest of what is the need. And of course, the way to conceptualize it, again, for the students, is there are differences between urban and rural, because of the resources and assets. I have many stories to share, but just to put a long story. So the research area of the academic side, at least there's this whole top-down line of work and bottom-up. But one thing that, again, leads to international academic interest in this area of work is the case studies, which CCOUC or my research team managed to build together. We write cases that are normally not reported globally, not because it's not important. There's simply no academic researchers in our side of the world to write about this. There's almost no funding, but there is definitely a lot of lessons learned. So yes, people said that you managed to publish in Nature, in Lancet. Part of the reason is because I pick very interesting topics that people may use as a basis to build other things. Like if I may highlight some from the Wenchuan earthquake is the melamine. The melamine story is the milk product, is the contaminants. The reason why people quote this, not just because it's a description and it's a background, describe why that happens as a failure, a moral failure of the commercial system or the pharmaceutical community that leads to issues of production of safe food for children, for infants. But the reason why it becomes an interesting article, because in the academic world, we typically, the old style at least, we don't quote directly from newspaper. So we have to quote from some academic reference. So as a result, it's not easy for academics to write about articles that may not yield typical academic results because of interventions. But that also leads to another thing. If anyone's interested in this area, it's not difficult. If you produce reasonable, high quality of good work in case study, you get published. Because there's simply a thirst of information and frontline knowledge. And of course, I write about some rare cases like explosion of the container terminal all the way to the Rohingya situation. Okay, so that again gives, a job, a gap, and academic discipline to be developed. Okay, so for young researchers, pick this up. It will be an interesting area for you to do. It's very meaningful, very rewarding. And of course, for frontline experience, because in the academic world, and I think that was also what Mr. Kuok wants wants this support to become a more solid reality, is that we have to offer opportunities for young learners, colleagues to be able to learn their field skills. Many of the times we assume that, okay, we give interns for NGOs, and for good reason that wasn't real work happens. But it's also a lot of burden on frontline group because they are doing the real work. They need trained people. So where do they got the first step in the humanitarian journey? So it has to start with the university or someplace that solid training may be offered. So across, I guess, about 10 or actually 15 years by now, we have been building small community projects in various parts of China, ethnic minority based. And our goal is to ensure that we go to the field and build interventions that hopefully will work. If not, at least gain the experience for the staff to understand that if you were to do intervention and promotion, that is what is needed. I have to point out a few of my colleagues with GX, include Caroline and Grace, was my early, when they were many years ago, still very young, joined us in the field, and by now, they are my directors. One for Africa, the other one Southeast Asia, after they've had their specialty training or other training in their life, because they love and they believe in this kind of work. And as a result, they are now doing frontline work, but they love to have students too, because that is how this field will manage to develop. And our footprints, of course, go further. Very interestingly, of course, Nepal with the earthquakes. And I remember early days, it was my other colleague, Bong, who is now with the school. We went to the field to do our work. And then we also went to very hot spots. Aside from, you can see Professor Samuel Wang, it's DPRK. It's very hot the past few days and the next few days, but it's North Korea. Okay, again, we learn a lot, and it's an interesting experience as an academic to be able to teach in the university. But I want to highlight to everyone that academic offers you a platform, almost a boundless, borderless humanitarian corridor for researchers to work together and document and to teach and to hopefully generate some new solutions for the world. So that was bottom up. And how about top down? So the number of you will know me not because of my frontline work. I have a few colleagues here from the environmental, meteorological side or science because I do climate work. It was again back then when I built my career, Professor Shaw Griffiths told me that if you continue to do humanitarian work, you may not be able to get any funding because it's not there. Why don't you get to an area, at least there's some modeling, some work that is for the future? That was actually 15 years ago, and she was wise. So I started with a few of my colleagues, Bill Goggins, Professor Bill Goggins, and a few others, and hopefully to build things that will be meaningful. And one thing led to the other. We ended up doing 27 studies with modeling capacity to a point that with the support of the observatory, we helped to support the update of how warning is done in Hong Kong. And when during COVID, we were in the advisory team of COVID and the meteorological situation. And the other thing is, I have my colleague, Professor Ying-yang. We are also now recognized as a little center, as by International Council of Science, as one of the global center of excellence that solve or hopefully identify issues and reduce risk for disaster humanitarian work. I think the important spirit of that is to show that even policies are there, but in order to find units, research teams, advisory teams that have the ability to generate scientific solutions, actionable science as we called it, that is usable to use and to be used is not that easy. So we do a lot of research. And the latest, of course, I was together with my other colleagues because I still have a maternal academic unit at Oxford. And through their support, we are now linked into 7 other institutes across the world. And we are in this very interesting project called After the End, supported by Wellcome Trust. Essentially, our work don't only do physical science. In fact, the scientist that is very dear to me with this team, that was the QR code, is from humanities and social science. To some extent, the emphasis is that we think about time in a very linear manner. But in disaster, it does not, because it's cyclic. So that I actually want to illustrate 2 things. We have a very rich platform in Hong Kong, China, that offers young scholar, learners, and supporters to do this kind of work. And this is ongoing till 2032, I believe. So these are my very important dear colleagues from university. The last thing, I need to cross over to my GX experience to illustrate other parts of the digital era situation, is that we don't only do our own thing. In fact, we are very passionate people. So as a result, my team during COVID, this is another thing I want to share with you. Everyone will know in Hong Kong that COVID is a big thing. There's major policies, there are major advocacy about home care at one point. But this is just to illustrate that when WHO declared that there is a public health emergency of international concern in 2020 in January, until all the way before the vaccine was launched. That was 10 months. In that 10 months, basically there's not much treatment or guideline or basic guidelines, but there are not much going on in the community except for quarantine measures or isolations. And then because we were in some of the expert committees, there was this whole discussion whether home care guidelines should be updated. So as a small team, together with my colleagues around the world who are all volunteered to join this initiative. And I understand with that team, there's also Professor Ying-yang and Samuel and other colleagues. We update the guidelines to ensure that there is the WHO home care guidelines for COVID. That was in August. And further along the line, when Hong Kong experienced the 5th wave of COVID, that was the time when I'm with GX. Mr. Leung originally said, we just focus on our work in the field, but he's actually a very passionate humanitarian. He decided that, okay, let's just do something. And he, with the team, translate the protocol into 8 languages. It's possible because GX works in many multi-countries. And with that, we are not doing things in Hong Kong, but that was one of the few occasions, aside from working with students, young talents, and our senior volunteers, this is one of those things we are actually active in the community. So that is so much of my university life. I don't have much time, but at GX Foundation, I must say a few words because that was where my field laboratory right now is. It started, of course, with national policy, with the interests of people and people connectivity along the Belt and Road in 2013, but that was way before I joined. This national policy in 2013, and with a very persuasive chairman, Mr. Leung, and also Professor Arthur Lee, and Dr. Go, they decided to make sure I joined. And during that time, the university is kind enough to allow me to second. At the starting point was 2 years. Now it's my 7th year. I never stopped working in the university, by the way. That is my second or my third job. But again, there are many stories behind GX Foundation. I need to bring it out because I want to highlight to, again, young scholar. If you are interested in solving world problems, you need a laboratory of some sort. Laboratory is a description. Laboratory for humanitarian medicine, disaster medicine is in the front line. And you need people, resources, and collaborations. So anyway, GX Foundation, after it started for 7 years, we have 5 areas of work. And I'll just quickly go through because that will illustrate that, many things. We have finished 30,000 successful cases of surgery across the world in 5 countries. And I want to highlight to you that the humanitarian spirit of it. Typically, people think about humanitarian work as acute. They address needs in emergency and disasters. But one area of work we do is to address cardiac cases. Simple 25 minutes mobile clinic, which is only possible, or at least made possible by digital, by technology. The right-hand side is the typical machines which my Caroline brings to the field, to Africa. There's lots about how the logistic arrangement may be. But the left-hand side illustrates another important point. we are allowed, or we are able to treat patients in all walks of life. The gentleman in red is in death penalty. Typically, many programs may not address their needs, but for us, it's dignity. It's the right to dignity. So when we do our case, we will not ask their background. There's a need. If we have the capacity, we will try to address. And the digital side of this is, in order to make it possible, we have to upgrade our device. I think Mr. Leung, together with my team, is upgrading the 2.0, or actually the 6.0 version. This version is already with 5G, enable telemedicine, enable quite a number of very sophisticated device. We remodel the container to ensure floods or this desert terrain can function. And on the right-hand side is the allographer. Again, for people, just to illustrate, in fact, working in the field, you will not have all the support you normally have in a hospital. You may have only one nurse to support like 3 doctors, or there are no doctors, or the system could be all sorts of life. And I would tell you that there are so many stories about in the field. I mean, the one who actually makes things happen is not the doctor. It's actually my logistic or my staff team, which is very dear to me. And that was what I learned in my early life with other NGOs, is that in order to do medical humanitarian assistance, it's a teamwork. And that's why by now, even with JICS Foundation, 70% of our staff team may not be from the health side, but they're willing to learn. And from the health team, you have no comparative advantage because you need them to help you to make things work. So that was the spirit of it. But then all the digital era is hopefully supporting us to upgrade all the device when there's no electricity, no water, and somehow, even for digital device, it doesn't work in the context. Then the other thing is VBD. You can see that that lamp, it's one of the devices we distribute across the world. By now, we have like about 23,000 pieces that was going across the world. The mosquito nets, which I'm standing next to with Angelina, it is Timor-Leste, is mosquito nets with a hole. Because many of the places, because of the withdrawal of funding from many global agencies of the financial crisis, don't even have the basic device as mosquito nets. And as a result, I mean, together with the team, we put together very simple device. 5 pieces of materials include rampant dengue test kits, sticky fly traps. Basically, they are stickers, but it's meaningful, it's powerful. It can attract up to 600 flies within a few hours. Nets, lamps, and education materials. For those of you who are in health education promotion, you have a lot of opportunity if you are interested to do this. We need people. Come and build your capstone, your project alongside with us. We want people to do evaluation anyways. So everything we do, we evaluate. At least we try to learn, and the lessons learned is co-share with other NGOs. Okay, and we do habitat work where with water, Ryan was helping to build a number of other things, and disaster. Many of you knows that I love my disaster work, still do, and there are many generations of disaster. I have a disaster bag here. It all started with the early generations of disaster bags that I did with my students. The latest one is, of course, done by GX and crossover with what we learned. And I want to share with you for digital device. It's that we made a radio cheap, easy, and because it's in China, it's we managed to get cheap manufacturing. We want self-reliance for our community, and we try to put together it with the help of colleagues. Many of you in this room has been with me in the field before. This is one of the latest thing, not high-tech device, but in many ways, it's a handheld radio. And in island population, radio is the mode of transmission or communication. The most interesting aspect of this is, aside from having lights, which will support the community at night for safety, prevention of injury, prevention of fall, it also allows USB charging. And it allows solar panel charging up to 15 minutes, all the way to handheld, and you can put batteries in it. This is not something rocket science, but it's meaningful because my team is so determined that, okay, they said, give me a budget and we will design. So the hardworking team designed this. But I want to highlight to you, it's interesting in Tonga, not even, this radio, of course, is highly sought after. They would love to have it. As simple as a whistle. In emergency, whistle is the simplest, best device that we can distribute. It's cheap, it's low cost, it's sustainable. What you need to do is to distribute it and make sure that teach the computer few signals in order to know when to run, when to stop, and when to look for information or listen to radio. Simple. Okay, we think about high tech, which is important, but we need to also think about low tech solution for communities. Anyway, so that is also that was part of now a GX and CHIU crossover, and we are working with other partners in the field. Humanitarian talents is another area of work that again crossover back to our academic world. That is the Timor-Leste students. I know that they are here today. This is CUHK students, okay, in the field in Senegal. And this is my dear GX community, the young ones, I mean my GX club. And that was when we brought everyone to Vanuatu to celebrate the National Day. Again, that's another crossover. The students, when they're in the field, they work very hard. We make sure they work very hard. There are a few who are in the room. They will tell you that for that 7 days, on average, they sleep 3 hours per day. Okay, because they are very eager to, and it was actually ingrained because when you bring them to the field, whatever they have developed, they realize doesn't fit the local context. They are very willing. They are willing not to sleep, to just do their own thing, to update it and upgrade it. And that is the spirit we want to encourage. And that's why it's always fun to be in the field, but it's always very tiring too. So I almost have no time. I only have 10 minutes, but it's still important because typically Mr. Leung always encouraged me, in order to have a topic discussed, 7 minutes is good enough. So I have to tell you my background because I want to encourage the young scholars to think about how to develop this or cross over your own subject with this. But how about the digital era? Let me start with WHO definition of health. It's physical, mental, and social well-being. Clinical doctors deal with physical health, but there's this important aspect of mental health and social health. And as a result, when we are in the field, there's always ways to solve problems if you want to address an aspect of health. Digital era, there are many terminologies in the internet that talks about it, but I just want to make sure that in this room, at least after this lecture, remember one thing. We are actually in post-digital era, by the way. It's no longer digital era because nowadays we are talking about technology is no longer a separate tool, but it's an integrated tool. When we talk about the real digital age started, according to the sociologists, in 2002, when digital storage already outdo analog capacity. So for the past 18 years or 20 years, we are in that time. Ask yourself, what have you been doing in the digital era? Now we are in the digital post-digital era. And this is a good way to think about this problem. What have we done in digital era with all this technology? WHO has been talking about it. Aside from what do you do, what are the technologies available, and what are the challenges? But I want to bring out the positive but the negative side, because in the humanitarian world, we always try to reduce harm. We use technology, we try to also ensure protection. With digital device literacy, we know that the digital divide is there. We marginalize people. Basically, in the old days, marginalization would think about health, you think about economics. Nowadays, it's ability to use devices. People in this room, most of you are at least 18 years or above. I won't ask you to raise your hand, but how many of you think that you are digital savvy? You may use a phone, but that is as good as just using a regular phone. Okay, I mean it's interesting because I mean the idea of the digital humanitarian response is that I do argue, and we keep on working on that from the academic side with my after the end colleagues, is that we talk about innovation, how the ethics, the legal framework, or how do you protect those who have no access to it? As simple as they may have resources, but people of older age, they're not used to it. And you cannot expect them. And by the way, don't think people are very old. I have a grandmother who is 107 years old. Okay, so you are definitely very young in that comparison. And she still survived. And she has this picture with the nursing home that she was the poster lady to learn about using the iPad 2 or 3 years ago. So imagine about this. But I mean, I guess the idea, another important challenge aside from the digital use and whatever you think about the limitation, the marginalization of those who may not have access. Is that nowadays we don't only talk about global health or public health. We used to talk about One Health. That includes human health, animal health, and environment. The latest frontline or frontier is planetary health. Okay? It goes beyond just animals, living things. It's about culture. It's about sustainability. Again, it's a new non-charted area, but that gives us one important aspect. You have to understand the paradigm shift. That gives us an opportunity to get resources and work together with environmental people, work with other areas or walks of colleagues to work closer together. In the old days, we talk about pathway of care, which is what Professor Sean Griffith taught me, that if you think about solution, just along those lines. Find some ways to think about a solution to solve the problem. And then before the digital era is actually very paper-based, face-to-face based, and many of the times it's based on very solid time hours and resources, okay? The latest endeavor that GX does with the support of, our board and Mr. Leung is actually personally trying many of these devices, is we try to develop something called clinic in the box. In the old days, it's a physical clinic, which we still probably in the physical structure, but we have all the devices ranging from your blood pressure machine all the way to ECG machines, even to the fetal device for Doppler. The other important application of technology humanitarian work is drones. The drones, of course, people nowadays talk about drones in war and conflicts, but think about use for humanitarian grounds. It can help with laboratory diagnostic tests, delivery of drugs, rescue, and potentially to do surveillance and risk awareness. It's a very active area. Health cannot do alone, but health is definitely a partner. And they need health people to give them the insight what to do. My father used to say, insight is actually a mixture of exposure and experience. And that's why even if you see how it works, the challenge, if you list it and if you talk about it, people will pick it up and try to find a solution. So in digital era, I will highlight and argue that potentially the most important thing for us is to be out there in the field. Use the device, use it wisely, ethically. But the idea is that all these important measures will be important to solve problems. Okay, so in view of time, I would have to stop very soon, but I actually want to show a few other pictures, if you allow me. I actually want to tell a few quick things about the infrastructure, because that is another area of work that would be meaningful. Because of how we developed Untitled GX and also CCUC, we always try to build field programs, and we always try to write it down and try to publish it. We managed to get the latest publication in 2006 in March in Lancet as a letter to talk about large-scale project. This time, we talk about how we work together with infrastructures. Infrastructure is interesting. People always talk about, oh, those infrastructure are going everywhere. And China, our country, is in the moment when they are very active in helping many countries to build their development projects. As a result, we are in the best position to hopefully convince infrastructure projects to work closely with us for the benefit of health. So if I may show you, one of the most interesting project we did is in Laos. We actually managed to partner with the Lao-China Railway, and across the 27 plus station from China all the way to Laos, or the other way around, we lace mosquito lamps across the platforms. And we are lucky and we are very proud to report that within that 1.5 years of project, there's not a single worker infected by dengue. And that's why, as a result, which IRDL has published as a case report to encourage people to do more. And because of that, we actually have other projects we've done in the motorway in Cambodia. And as it goes further, we are aggressive. We lace the airport, raise the canal, we go to Fiji to lace 13 airports across the island population. That's why my team is now actively going and chase mosquitoes and flies. But essentially, it's a meaningful thing to do when our country has stability and happens to be in the stage of economic development that there are companies, the engineers are out there, And that's why so far we are very lucky and they are very supportive. I mean, for projects, infrastructure projects, when we try to convince them it's a good thing to do, they tried. And so far, we managed to show very interesting results, and that gives us a publication lesson. So I just want to highlight that. And this is so far as we can do. By now, GX has donated 296 tons, okay, of materials, quite a lump sum. And definitely this is something that I think my chairman, my board, Dr. Kuok and Professor Lee didn't expect when you recruited me, okay? And they go as far as being convinced, and they actually joined me a month ago to host a WHO SAI event as the first NGO from Hong Kong that hosts a major SAI event. And this is exactly the title, Keep It Simple, No Mosquito, No Dengue. It's simple, but it's difficult. My team actually argues for a while what exactly is the tagline, okay? But, and then during the time, my very hardworking team was running around in Rwanda, working with the PolyU team because they are doing lights and they're doing solar panel to again continue to talk about no dengue, no mosquitoes. So Rwanda is actually our 12th country before Tonga. So much is being said. I don't have enough time, and I would just want to summarize by sharing with you what the central arguments I want to share in this lecture. I would argue that our global frame of reference is different compared with most of us when we were in college, and those of you who are in college now, in a few years' time, it will be different. So understand the latest paradigm, okay, and understand the latest risk requires being in the front line. That is something I cannot stress enough. Second of all, this is definitely a multidisciplinary world that we are talking about. I mean, if you want to be successful, at least effective, you must work with other partners. And there is a need of ethical and legal framework to guide applications and policy making in the front line for response and to protect the most vulnerable. And if we talk about global public health diplomacy, at the end of the day, at least from my point of view, I believe it's the ability to convince people to join in this crusade, if there is a crusade. And that leads to, I just want to share a few pictures. These are the team at the beginning until the end, what we do in the field. This is my team of Chunnan and Caroline and my university team. This is my GX team. We have a lot of very determined, very able, and I'm very lucky, retired colleagues from uniform service, from many walks of life, help us. So we may not have enough resources, but we have a lot of like minds. We have a community. And the community I love for so many years. And these are my team, you can see. And this is a crossover. See, Mr. Leung is there with CUHK students. And this is my family, my kids, and my sister, who was there since the beginning. And of course, thank you very much for my husband, Eric, who has been there. It's not easy, by the way, for the girls in the room. It's possible to have a family and have kids and still have a career and still running around, okay? So it's an interesting thing, but thank you very much. This is another picture that holds very dear to me. This is the first picture I took when I bring my first team to rural China. I hope Edward is here. I'm not sure Edward is here or not, but it's my architecture professor who at the beginning, at that time, he's more senior than I am. And he managed to have resources. He decided to take me along with him to the field. So they were building houses. I was doing my public health work. And the rest is history. We collaborate, work in the field projects. And that is the beauty of being able to work in the university. You work with people. Last but not least, diplomacy is not just about in the field, it's about mixing. I'm not a sport person. This is a rugby team. And I'm so excited. And my team was there. And everyone was there. And then we just run to the field because they think it's a good idea. So we share a common goal. We tell them, well, we want to kill mosquitoes. That is a good idea. So let's take a picture. So that was, but it was a, but I would tell you that in the field is where the excitement lies. So thank you very much. And I would want to take this opportunity to thank you, the Kuok group. Thank you for the support. Thank you, Mr. Leung, for putting GX Foundation in the front line as a laboratory. Thank you, Fizi and Dean Chiu and Anthony for all your support to enable this to flourish and all my colleagues and families. So I appreciate very much. Thank you, the audience online. I appreciate for you being there. And I think it's now for me to open the floor to questions. Thank you.
Before we conclude, may I please invite you to the front row to take a group photo with the audience? Ladies and gentlemen, this concludes the inaugural lecture. Please rise for the exit of the official procession.